Now, once a coronavirus vaccine is approved, distribution will need to happen fast, with long-term care facilities among the first in line. Big pharmacy chains like Walgreens and CVS are stepping in to help big time. First on CBS This Morning, we're joined by Rick Gates. He is Walgreens' lead executive for the COVID-19 vaccine. He's also the company's senior vice president of pharmacy and healthcare. Good morning. Good to see you, Mr. Gates.
Good morning. It's great to be with you.
We should also point out you are a pharmacist by training, so you know what you're talking about here. I Googled this morning. You might like to know this, Rick, that a pharmacist is in the top 3 of the most trusted professions in the country. So kudos to you on that. But let's start with Walgreens. This is what you guys do. You administer vaccines all of the time, but you've never done it on this scale. So what are you doing? How's the process going to work to make sure that the long-term facilities, also known as nursing homes, get this done and get it done effectively? What's the plan?
Yeah, and I think what you said up front is what's most important. This is what we do. You know, I'd say actually pharmacy has been vaccinating for well over 10 years. And if you actually step back, we were one of the leads in expanding it in the H1N1 pandemic, and I had the pleasure of trying to plan that as well from a Walgreens perspective. So, you know, vaccinations and getting out and protecting Americans is what pharmacy has been core at. When you look at it from the COVID pandemic, obviously we've been working tirelessly over the last 6 to 8 months with obviously OWS, HHS, CDC, and the states to ensure that we have a very solid plan for when there is vaccine approved, and then getting it out into plans with the states to get to long-term care facilities.
So do you have logistical concerns? Because as you know, Rick, this is massive.
You know, I would say that if you think about off-site clinics like we're doing with long-term care facilities, we've been doing that as well for years. We've done about 150,000 off-site clinics over the last 5 years. So it's something that's core to what Walgreens does. So we do that consistently. I would say logistically, there are nuances to the COVID vaccines. So in particular, the Pfizer vaccine and the ultra cold storage, we have had to make some logistical changes, but we're very confident that the freezer storage facilities that we have, as well as dry ice type solutions in hub locations, will allow us to safely store the vaccine and then ultimately get it to the long-term care facilities for administration.
So once it's open to the general population, what's to prevent people from just storming the stores? How are you going to handle that?
You know, obviously there are concerns with general population, but I would say that, you know, Secretary Azar said earlier today, you're going to see consistent amounts of vaccines that will be out into the population. And it's going to be something that we're going to be managing with states to really prioritize populations, ensure that the right patients are scheduled. And we obviously are protecting the patients that have been prioritized by the states as well. You know, I don't foresee it being long lines waiting for it.
But do we sign up? Do we sign up? Is it going to work in a sign-up basis, or is it first come, first serve? I'm trying to get people to understand exactly how the process is going to work.
You know, a lot of details still being worked out for phase 2. A lot of our focus has been on the long-term care facilities for phase 1. I would say for the general population, the expectation would be that we will follow state guidelines for prioritized populations. We will work with that to ensure that we have the right people signed up, scheduled, and with appointments so that it's easy and seamless for them. And obviously we need to ensure that they get second dose for those vaccines where it is necessary.
Rick, it's Tony DeCopel. Your rivals, CVS, say they're hiring thousands of additional workers to help with vaccination, admin, and also distribution. Are you also hiring workers? And then a second point on that, CVS is talking about potential hero pay, they call it, for people who are doing the job in a higher risk scenario, like going into long-term care facilities. Is that something you've thought about?
You know, we're looking at all different ways to ensure that we have the right staffing and appropriate safety protocols for our team members and obviously for who we're protecting in long-term care facilities. So we've run the gamut to ensure that we've got the right staffing. If we don't, we're going to hire up in the appropriate areas and ensure that we have the right pharmacy teams going out to these facilities to ensure that we've got safe and effective vaccination for all residents of long-term care facilities, as well as obviously for any of the employees as well.
People are still very afraid, Rick, to take the vaccine. You know, we were making a joke about the lady in Britain who got it, and then you saw her break dancing or dancing. I mean, I think that's a great ad campaign, but, you know, people are very, very afraid. What are you going to do to help people with their comfort level?
Yeah.
You know, that's a great question, and I would actually look at the flu vaccine even this year. We've had record numbers of individuals get the flu vaccine this year, but still, well, I think it's close to 50% of Americans did not get the vaccine. So we're going to have similar challenges from an education perspective when it comes to the COVID vaccine. We've got to work with CDC. We've got to work with the pharma manufacturers and understand the science behind it so that we, I think you call us one of the top 3 trusted professions. I think pharmacy can play a huge role in education and ensuring the public understands the actual safety of what this is and how we actually are putting protocols in place to ensure that safety going forward as well.
Yeah, people trust the white coats. All right, Rick Gates, thank you very much. We appreciate it.